there has been a tremendous need for advanced liver care in the community. So we embarked a few years ago to establish community-based liver clinics. Southern California Liver Centers offer advanced liver care to the community, not only in tertiary care centers and universities, but straight into the community clinics and in the community hospitals.
I was told I had a fatty liver. Then 10 years later, I was told I had the onset of liver disease due to alcohol. And then most recently in the last 2 years is when they said I had cirrhosis.
I have cirrhosis of the liver. I also got platelet levels are down to 2,200.
And you can imagine these clinics started to grow very fast. The idea got a lot of attention. And we started with 2 clinics, and we are up now to 7 clinics in Southern California.
I run the Hepatitis Treatment Center here at Southern California Liver Centers, where we look at the patient in a very comprehensive way. Not only are we evaluating their viral hepatitis, but then looking at them as a whole person and all the comorbidities that they come with, and making sure that we're addressing each and every one of those needs for them.
My specialty is fatty liver. That encompasses basically the metabolic syndrome. So I get patients with obesity, with diabetes, with hypertension, as well as diagnosed fatty liver. For us, it's really about lifestyle changes, and we do it in a unique way in which we take the patient, we talk to them about what they eat, and we modify what they eat. We take an exercise based on what their schedules are, we make suggestions. We get the patient really to buy into this and work with them in that way.
Here at SCLC, I care for a large number of end-stage liver disease patients. These are very complicated patients with multiple comorbidities.
The idea is, even if the patient gets to the point of end-stage liver disease, how can I extend their life with quality before I call for a liver transplant? And the concept that we nailed, that we called it HALO as a group, became part of the care of all our liver patients.
The HALO concept stands for Health and Liver Optimization, and I believe that we really do that.
This idea of HALO is really taking a very experienced team of clinicians and educators and academic researchers and providing a community-based model for patient care.
It's a concept in which the patient becomes our partners, so they make decisions with us. We're not just dictating or prescribing for them.
Part of HALO is involving the loved ones and the family members and the wives and the husbands and the kids. You can imagine it's a symphony that needs to be played perfectly, and the perfect outcome is better quality, less morbidity, less mortality for our patients. Having said that, there are patients who fail standard treatment, and our close collaboration with Southern California Research Centers allowed us to offer all our patients who fail standard therapies, the most advanced new therapies in the pipeline of approval.
One of our unique aspects is we do from phase 1 studies to phase 3. We also do studies in patients who are hospitalized as well. So we do pharmacokinetic studies, pharmacodynamics, bioequivalence, bioavailability studies. So the idea is that we're a resource here for the community. So patients should never feel like hopeless or, there's nothing else out there for them.
We're doing a number of studies on hepatic encephalopathy, hepatorenal syndrome, which are frequent comorbidities in the end-stage liver disease patient.
Basically providing their patients with a continuum, so there's always hopefully an option for them that's outside of standard of care.
This whole program is what I call it a community tertiary care center. That helps the patients in the community for the management of the liver disease. It allows these patients access to cutting-edge medicine in clinical trials. It supports these patients when they get hospitalized in the local community hospital to have the specialized level of care that we would like to give our patients.
To me, he's been an angel. He's watched over me since 1998, and he takes care of me, and I trust him with my life.
That's what the crew and the team here does. They save lives.